Welcome back, everyone. In this module, I'll be taking you through the stages of labour. Labour is defined by 3 different stages. The first stage is dilation or opening of the cervix from 0 to 10 centimetres. The second stage is pushing and birth of the baby. And the third stage is delivery of the placenta. The first stage of labour is separated into 2 different phases. You have the early phase and the active phase. The normal length of labour is different for every woman, and it's influenced by a number of factors, such as the number of babies she's birthed already, her psychological state, so if she's feeling anxious or stressed, level of nutrition and hydration, and the position of baby. When having your first baby, the early phase of labour mostly involves effacement of the cervix and dilation to at least 4 centimetres. Effacement is the process in which contractions and the pressure from baby's head cause the cervix to become very soft, and the muscle fibers of the cervix actually retract upwards into the lower part of the uterus, leaving only a paper-thin layer just below baby's head. It's often the longest part of labour, and it's characterised by irregular contractions that may stop and start a number of times. So this process must occur before the cervix can start dilating. However, women who have given birth before can efface and dilate at the same time. Dilation of the cervix is the opening of the cervix from 0 closed to 10 centimetres, which is fully dilated, at which point there is actually no longer any cervix blocking your baby's head, and it opens the gateway from the uterus to your vagina. So in this diagram, you can see this is a long and closed cervix, so not effaced and not dilated. In this one, you can see that there's no cervix left, but it's just 1 centimetre dilated. Here it's halfway through, so it's 5 centimetres. And here we are fully dilated, 10 centimetres. There's no cervix left, and baby's free to pass into the vagina. Okay, everyone, I'm not going to sugarcoat this. In order for your cervix to dilate, your uterus will need to use its incredible muscle power and contract regularly, thickening the layer of muscle at the fundus. So that's the top, remember, in order to push baby downwards. In early labour, these contractions may start as a period-like pain that gradually builds upon itself. And this is the part that varies for most women. So some women might have really irregular, so less than 1 contraction every 10 minutes, and quite short, so less than 45 seconds, for example. And these contractions could go all night long, only to dissipate in the morning and then begin again at bedtime. And this pattern could go on for a few days. That is really, really normal. Other women might be a bit different, and they might contract regularly, so like 2 to 3 contractions every 10 minutes, and they could vary from really long to short, and this could go on for an entire day. And I hear you all out there saying, this sounds exhausting. And unfortunately, this can be the hardest and most anxious time in labour because you just want to get things going. What I find when working in the birthing unit is that most women don't know about the first stage of labour or early labour, and they come in expecting that their baby will be born any minute, and then they feel really deflated when we tell them that they're 1 centimetre dilated. They lose confidence in their bodies and they want to tap out of the marathon before it's even begun. So having some understanding of the nature of contractions and how they're working to open your cervix, it can prepare your mindset and your expectations of labour. So my suggestions for early labour: stay really hydrated and eat nutritious food when you feel like it. I'd probably suggest small portions. If you are vomiting a lot, which is quite normal, if you can't keep any fluids down, then it could be a good idea to call your care provider for some anti-nausea medication. Empty your bladder often. Rest as much as you can. So don't be running up and down stairs and doing lots of lunges now, because you probably have a big marathon ahead of you. Having some familiar comforts around you, so your favorite pillows or blankets or music. If you like massage, get your partner to give you a massage. Use a heat pack and just get into any position that you can tolerate, so preferably off your back. Okay, the active stage. So the active stage of labour is thought to be when your body gets itself into a regular rhythm of long and strong contractions, resulting in progressive dilation of the cervix from 4 to 10 centimetres. This is also called established labour. For most women, this means contracting at least 3 times in a 10-minute period, with the contractions being really strong. So your abdomen goes rock hard, and they last about 60 seconds each before relaxing again. So remember, when you're having that contraction, you will get at least 60 seconds in between contractions before you have the next one. So you have a chance to rest, gather your strength for the next one. To get into this phase, women will need to switch off their rational thinking brain and get primal. I know that sounds silly. And it's not a conscious thing that you will do, but rather you might just start to turn inwards and rely on your instincts. So you might be keeping your eyes closed and just trying to block out what's going on around you. Things can really heat up at this phase, and it's quite normal that whilst you're finding your labour groove, your partner might be quite distressed seeing you watching you behave in a new way. Every woman is different in how they labour. You might be really loud and moan, scream, or cry. You might be really quiet and still. You might be constantly moving and unable to find a comfortable position. You probably won't be able to process questions or instructions. You might want your family or children to be around you, or you might just want to be alone. You might want your partner to be constantly touching you or to have no one touch you at all. Or you might want to be on the floor and have lots of freedom of movement, or you might be just happy to rest on the bed. And whatever feels natural to you is absolutely normal and perfect to do in labour. For a woman having her first baby, it's normal for the active stage of labour to be around 12 hours. But again, it's also normal for it to be faster or a bit longer than this too. There are no rules about what you should do in labour to help you cope, and every woman has their own way of managing pain. Some of my suggestions that might work for you: using music for distraction, putting on a playlist of your favourite songs or music that just helps you to relax, aromatherapy, so maybe using some energizing scents, getting in the shower can be really helpful, especially on your lower back, making the room nice and dark and warm, using a heat pack, using a TENS machine. If you like massage, go for it. And a big one for me is focusing on your breath, using long inhalations and exhalations really nice and slow, because most women, they tend to clamp up and hold their breath when they're in pain, and this will just make your body and cervix to tighten. So it's probably going to feel really counterintuitive at first, but if you can try to just loosen your muscles and relax into the contraction, your body is going to open up a lot easier. So how will you know if you're fully dilated? When your care provider steps back and just lets you do your thing, they might notice changes in your behavior, movements, and sounds as you get to fully dilated. You'll probably say that you want to do a poo or you feel a lot of pressure in your bottom. And this is the point where we get really excited and we get our gloves ready. So your labor also might slow down a little at this point, and this is just your body's way of giving you a rest before you have to start the next job of pushing. Some care providers might offer to do a vaginal exam to confirm that you're fully dilated, but this isn't always necessary. Okay, the best person to know when you should start pushing is you. So there'll just come a certain point where you just can't hold back from pushing, and it will finally feel good to use those contractions. If you have consented to a vaginal examination and your care provider has said that you're fully dilated, they might encourage you to breathe through the contractions for a while instead of pushing if your baby is still high in the vagina. Doing this will help you to conserve your energy, letting your contractions do most of the work to move baby down. Midwives love it when women choose their own positions to birth in, whilst most obstetricians will ask you to lie on your back so they can see what's happening. Gravity will be your friend during the pushing stage, and getting into an upright position off your back will help baby get lower with each contraction. Some ideas for positions are squatting, hands and knees, kneeling, sitting on the toilet or birth stool, lying on your side, or just whatever feels good for you. And this might actually be lying on your back. These are some examples of birthing positions. You can get creative and use pillows and bean bags or your partner to help you get into a comfortable position. So each facility will have a policy on what they consider to be a normal amount of time to push out your baby, and this usually is about 1 hour. This actually doesn't take into account your individual situation, position of baby, or how high the baby was in your vagina before you started pushing. If you and your baby are both coping well during labour and pushing, it could be appropriate for you to ask to have more time to push before needing help to birth your baby. The moment you meet your baby for the first time can be a bit of an out-of-body experience for some women, and you might just need a second to come back to earth and catch your breath. Immediate skin-to-skin contact at birth not only helps baby transition to life outside of the womb, but it also helps you transition to motherhood. If your baby is healthy, there's actually no reason for your care providers to take your baby away from you to be weighed, measured, or have injections, for example, in the first hour of life, and baby has had their first breastfeed if you intend to breastfeed. The third stage of labour. So this is the delivery of the placenta. So while you're having your first cuddle with baby, your baby will actually still be connected via the umbilical cord to the placenta that's inside your uterus. But the placenta is no longer needed by baby to supply oxygen and nutrients once they are born, and it will need to be expelled from the uterus. So this can happen in a physiological, so natural process, or it can be actively managed by your care provider. And this is a photo, well, a drawing here of active management. So in a physiological third stage, if you have no risk of bleeding and your care provider has no concerns, your placenta can be left to come away from the uterine wall itself and be pushed out from the vagina by you. Most facilities usually have a policy on the maximum amount of time they recommend to wait for the delivery of the placenta, and that's usually around 30 minutes post-birth. So breastfeeding, nipple stimulation, skin-to-skin contact, sitting on a toilet, these can all be really helpful things to do to get your placenta to separate from the uterus. In active management of third stage, women who have a risk of bleeding after birth, they're usually recommended to have a syntocinon injection in their thigh at the time of birth. Syntocinon is the synthetic version of oxytocin, and that's used to initiate a big contraction in the uterus to separate the placenta from the wall of the uterus. Your care provider will need to gently pull on the umbilical cord, which has actually been cut now. And it will need to pull on the umbilical cord whilst applying some pressure to your lower abdomen. So this will encourage your placenta to come away from the uterus and then be pulled out through your vagina. All right, thanks guys. I'll see you in the next module.